Hi, my name is Christine Cox, and I'm a nurse practitioner here at Frontline Mobile Health. After spending years in a hospital watching what's supposed to be a healthcare system actually be a sick care system, I knew it was time for me to move on to a place where they took the spirit of preventative medicine and made it the front line of what they did. And that's what we do here at Frontline Mobile Health. And what better populations to serve than the people that put themselves second all the time to serve us? Our police officers, firefighters, our EMTs. Sometimes we find things that helps people take their health from good to great, and occasionally we find things that are actually catastrophic and allows them to get early treatment. Either way, instead of me telling you about those things, I'd much rather you hear it from those people that are brave enough to step forward and tell you about it themselves. These are their stories.
Hi, I'm Sergeant Sherry Alldredge with the Fort Worth Police Department. I have about 30 years of law enforcement experience. I started out 5 years military police with the Army, transitioned into the Sheriff's Department for about 5 years, and now my assignment right now is back in recruiting. I'm a sergeant for the Fort Worth Police Department. I decided to get a physical with Frontline because our department recently just went to Frontline, and since I'm over background in recruiting, I wanted to be able to go through it myself. That way I could explain to the applicants what they were going to go through. I had read all about Frontline, so I was really excited to see what they did for the scans and have a complete head-to-toe physical since, this was going to be something new for our department. I was in the middle of one of the scans when the technician actually moved me into several different positions, and then that's when she said, it looks like you have a mass in your bladder. She actually turned the screen around so I could see it, and I asked her if she could make a disc so I could follow up with my physician. There was nothing really in my background that I was worried about because every year I do go to my physician. I had previously a hysterectomy and a bladder sling put in back in 2008, and then back in 2017 I had to have mesh surgery to have some of the mesh taken out. So other than that, I didn't have any other health issues. When I got the news and I was shown the scans, it surprised me because I had the revision surgery in 2017 to remove mesh, so I didn't know anything could be in my bladder. I've had pain over the last few years, but of course my physician just said, it was just aches and pains, and of course I wore, the gun belt and all the gear, and so nothing alerted my physician throughout the years, so I just lived with the pain. After Frontline made scans for me on a disc, I went ahead to the City of Fort Worth Clinic, and they were able to review the scans and then send me to a urologist. Right in his office, he actually stopped what he was doing and actually performed a quick scan with me, and he said that I need to get a CT scan very quickly. I was able to get one within a few days and return back to his office. At that time, he said, this is an emergency surgery. At any time, your bladder could rip open if I moved a certain way. I actually had 2 trips planned, one with my grandson and then one to go to Germany to see my son who's also in the military. So I actually told the surgeon this was not a good time for me, that I'll have to wait a few more months and then I could have a surgery because I knew it was going to be a long recovery. And that's when he said there's just no way of waiting, that he needed to get me in next week for emergency surgery. The surgery was very intense this time. They had to, of course, completely open me up, and it was a very difficult recovery. I was actually out of work for over a month, and I'm now about 3 months post-recovery. So what Frontline found was actually mesh that was in my bladder, but also it was going in and out of my bladder. And so the physician had to take 2 pieces of my bladder, completely remove it. The crazy part about all this is the surgeon was so surprised that I'd lived that many years with the bladder mesh in my bladder with pain, because at any time that it could be ripped open, I could have been septic. He said throughout the years I've had probably constant infection after infection, and it's just frustrating to know that all these years that other surgeons have missed this, and even my primary doctor, and this is something I actually could have died from. What I like all the officers to know is, even though you go every year to your primary physician, Frontline, I've never had a physical this intense before. With all the scans, these people are very caring. They explained everything very thoroughly, and I'm just surprised that they found something, but even when they found it, they kept in contact with me. They wanted to get one of my follow-ups. And even through my recovery, they would call me and text me and just make sure, very encouraging words, to make sure I got through this.
Thank you so much for watching today. We really hope that this information was educational for you and inspires you to step up and partner with us to make your health your biggest investment.